Good morning, everybody. So we'll start our IC. It's the Smart Eye Clinic. Basically, it is we are going to discuss how we can use our smartphone and all the newer technologies to our benefit in our clinical OPD and OT. So I'll be starting with the few smartphone related innovations. So the first one is the anti-segment photography with intraocular lens and related anti-segment imaging devices. So as we know, the slit lamp cameras are very expensive nowadays, and it's not a cup of tea for everybody, especially the postgraduates and fellows. So we've come with a very simple way of doing this. That is taking the image using the smartphone by just keeping your hand on the slit lamp, keeping a 1 finger distance gap, and then taking the image. The basic thing is it should be clear. The round edges that we see here, it should be clear. So that is your endpoint to take the image. So if you can do this in your free hand, it is the most easiest way to take the image, and it will give you a really good quality image. And the second method is to use an adapter. So this adapter can be bought from Amazon. It just costs around 500 rupees. And once you know how to fit the smartphone onto the adapter, it becomes very easy. So once you clip it and put it on the eyepiece, again we have to keep that 1 finger distance between the phone and the slit lamp. So once you do that, it becomes very easy to take images. You don't have to you don't have to stabilize with a free hand because it is already fixed to the slit lamp, and it becomes very easy for you to take images. So this is how we do it. So you just need to adjust the camera in alignment with the eyepiece of the slit lamp. So once you do that, you again see there was a proper circular edge that you get. That is the endpoint, and you can even take fundus images using this. So what about what if you don't have a slit lamp and you need to take image? So this is a very do-it-yourself technique where you can take a chart paper, and cut it into 10 centimeter to 1.5 centimeter. So once you've done that, you can fold it on each other, and in between you can mark these areas, that is for making a hole to keep the intraocular lens. So once you do this, you attach a double-sided tape into it, and then take a paper puncher and punch out a small 6 millimeter hole onto the chart paper. So once that is done, you can just remove the double-sided tape and stick a intraocular lens. So I would suggest something around 15 to 20 diopters would do the trick. So once you've done that, you just have to place this arrangement on the smartphone, and that will change your smartphone into a macro photography device, and you'll be able to take images without a slit lamp as good as a slit lamp. So this is how it is, and you can use it on all your phones. So you just need to on the camera, take the video mode on the flashlight. It should be continuously on, and then start recording by taking it near to the patient's eye. So it is that simple, and you don't really require a slit lamp to actually take that good quality images. So these are all images which we have taken from the IOL ASPE. And for those who don't want to do it, they can also get this. This is a 3D printed ASPE, which can be attached. It's just like a clip, and it can be attached to the smartphone, and you'll be able to take images very easily. Just clip it on and then take images. That's so easy. So next one is the ASPE Gonio. Basically, this is also using ASPE, but then the lens that we are using here is a 10 diopter lens. So you can use a 8 diopter, 9 or 10 diopter lens, and keep it on the Gonio, and you can take images of the angles also. Then we come to Scooby-Doo, smartphone co-edit cobalt blue photography do-it-yourself. So this is also a modification of the ASPE where we have added a blue filter, cobalt blue filter. So now, because that is done, it is very easy to take blue photography also. So this is a video taken of Seedles positive without a slit lamp, just with the smartphone and the Scoopy Doo. Next, I will go and speak about IOL scope. So IOL scope is also a modification of the ASPI device, where we have used 30 diopter lens, four 30 diopter lens, kept one upon each other. So it was stuck using the Fevicol adhesive liquid, and as you can see, the first lens was stuck, and then once it gets dried up, the second one. So the similar way, we add 30 diopter lens one on other, 4 of them. So the collective will be around 120 diopters. So that will increase your magnification of the smartphone. Once that is done, you can just fit it onto your smartphone, and when you put a slide against the illumination, like a torchlight over here, you can just start. So over here, you can see the slide is put against the illumination like a torchlight, and then take the image this way. So you'll be able to take images of microorganisms and cells, etc. So these are the results. So this is a fungal rhizopus video. This is a KOH mount, the same fungal hyphae, and then even parasites can be taken very easily. The sheep botfly, which was removed from the conjunctiva, and this is caterpillar hair. So these images can be taken very easily with the smartphone itself. The next one was what if. So this is another study that we undertook in the OT. So there was a mucormycosis epidemic, and we took these samples at the OT itself, live demonstration of fungal hyphae during the OT itself, and over here you can see the hyphae over here. So this was another study that we took up. A similar way, we thought, what if we wanted to do this in the OPD setup? So we thought, let's attach this setup to the slit lamp. So remove the slit lamp, the pivot joint of the slit lamp, and then attach this smartphone adapter that I've already talked about. Around 500 rupees you'll get it in Amazon. So once you fit it to and attach the IOL scope, so then you will be ready to take images of KOH mount and etc. in your OPD itself. You just need to keep the smartphone there with the IOL scope attached, keep an illumination source down, and then you can take images of the fungal hyphae at the OPD itself. This is a small video showing the same. You can see how corneal scraping is done, and the IOL scope is already attached. Just put it on the slide, and then you keep it, and you are able to take images, and you can even identify fungal hyphae from this. So these are all other studies that we have done. We can be used for demo decks also. Then we have the slit scope. So basically we thought if we can take images of without a slit lamp with the smartphone ASPI itself, but that is basically it's a diffuse light. So why not we make something with which we can get even the slit light. So we thought this was a problem statement, and that's why we opened up the slit lamp and saw what are the configuration of the slit lamp, and we tried to replicate that. So again we converted a torch by adding a slit onto the torch and adding a intraocular lens which would actually give us the slit. So this was the first video which was taken with my own eyes. So this was the slit that we have made. It looks a little thicker. So this was the first time we did it, and we got what we wanted. So then we thought, why not 3D print it? So we started 3D printing the actual size of whatever we wanted, and we were able to come up with a 3D printed torch adapter just for 350 rupees. And once we use that along with the ASPI, you can see these are all the images that we were able to take with the smartphone ASPI and the slit scope, and it was actually comparable to those with slit lamp. And these are the different cataract grading we could take, and you can see how clearly the slit was working well for us. The next last one is the gimbal scope. So basically we know that retinoscopy is very difficult to be done and to learn in the initial stages. So we thought there is a problem where the mentor is telling us how to see the reflex and we cannot actually see the live demo. So we thought, why not make something, get a solution for this. So again, the mobile adapter, we fixed the smartphone, and now we can actually take images through the retinoscopy hole. So you can see the with movement reflex, you can see the against movement reflex. So this actually helps us to explain like live demonstration of retinoscopy, which helps the mentor make the student understand how and what he's actually trying to see and convey. And then finally the trash to treasure red cam. So basically this is a do it yourself method by which you can take a hand sanitizer bottle and cut it in this particular shape and insert a 20D lens. So once that is done, if you have a smartphone with the flashlight and camera within 1 centimeter, you can just attach it to this and you can start taking images. And these are all the images that we have taken without a fundus camera, just with the smartphone red cam. Another commercially available is John Deere fundus scope that he will talk about while telling about the 3D printing. Thank you. I'd like to invite Dr. John sir for his talk.
So thanks, Dr. Prithvi, for that insight into the various frugal innovations that he has done. And now I'll be talking about a few of the apps which ophthalmologists will find useful, and something about 3D printing and so on. So without further ado, I'll go ahead. So there are a lot of apps. So I'm just going to go quickly through this. If anybody wants to take a photograph, feel free to quickly take a photograph. So I started programming when I was in school, and that's how I got involved in all this. So I'm just skipping through all of these and just going to talk about the ophthal apps which you will be finding useful in the OP. So starting from history examination onwards, there are several apps we can use. So for example, if you have a language barrier, there are apps which I made during fellowship. So that is I Know Tamil and I Know Bangla apps made during my when my studies in Arvind and Shankar Nethralaya respectively, for conversing with patients who are not fluent in English and you want to talk to them in Tamil or Bangla respectively. Then there are so many apps for systemic examination which will not be useful particularly for us. Visual acuity, there are some apps which can be used on the phone. So you can use the Peak Acuity app as a standalone app on your phone, or you can use the iChart Pro, in which you can control a tab with the phone and do visual acuity. So essentially that is converting a tab and phone into a visual acuity chart. Then stereo acuity can be tested by using this random dot stereogram testing app. So that is the NTU RDS screening test. For this you will need the red blue glasses. So ocular examination, you can do a lot of measurements by using these techniques. So here the measurements can be done with a scale on a chart on a face, and the measurements can be calculated by using Image Meter Pro app. And head position, eye position, there are apps like Eye Turn and Eye Tilt for measuring the head tilt positions, and the 9-gaze app for documenting the 9 gazes. Then a lot of anterior segment photography, Dr. Prithvi has covered it, and you can do all these photography much better than a slit lamp, commercial slit lamp camera, if you use the lenses and lighting correctly. And toric IOL marking, there are a few apps, toric IOL axis marker, iToric and Crystal Toric are very useful apps. Fundus Photo, there are a lot of devices. One is the Jaundas Fundascope, which is a foldable fundus camera. I'm not going to details of these. And this is a list of several apps which can be used. So this is not basically a list. I'll tell you the apps which are going to be very useful. So this app is having a lot of tests and calculators. So you look through this, you will have visual acuity, contrast sensitivity, color vision, pediatric optotypes, fixation targets, duochrome test, all of these in the same app. This is called the Eye Handbook. And you even have an optokinetic nystagmus drum, so you can have the Okain drum, and you can increase the speed of the chart moving, and you can look for optokinetic nystagmus. And I'll show you. Okay, these are on the right here. If you see, this is a device which uses a smartphone to do power testing of the spectacles, and that is from iNetra. Okay, so that is not an app per se, but that's a smartphone based lensometer. The Eye Handbook app is something which all of you can use for free, so that is something which I would suggest if you can download and start using, in which the calculator and the testing parts are what you will be using most of the time. So that is what we have covered. And there are several IOL calculator apps. If you are using a Toric IOL, use that particular company's IOL calculator apps. And there are all the visual acuity corrections, conversion between Snellen to Logmar. All this is available in the Eye Handbook, which I talked about earlier. And so these are all things which are there in the Eye Handbook. Due to shortage of time, I'll go quickly through this. There is an app to do the Farnsworth-Munsell 15 hue test. So that is in the colorblind test app. There is one of the options is doing a Farnsworth-Munsell 15 hue test. And Park's 3-step test is now integrated into the Eye Handbook as well. Stereo tab is again you use red blue glasses and you can do stereopsis testing. Stereo acuity cardboard is no longer available. Visual Fields Easy was the initial free version of the MRF field, so that is now a commercial device. Same Dr. George Kong had released the Visual Fields Easy app on the iPad. So if you want to do a very generic visual fields without sensitivity, maybe for neurological cases, you can do that. OCT browser, if you have the OCT files and you want to look through all the slices, this is something which you can use. And medication reminder apps for patients, there are a lot of apps, and My Eye Drops is one particular good app. IOL vision simulator for showing patients what vision would be with different types of IOLs. And this is not important. This is an eye grader app for postgraduates and also practicing ophthalmologists to have all the grading systems in ophthalmology. So you can go through this and then go for say bleb grading or diabetic retinopathy grading or disc damage likelihood scale. All these are in a common platform here. Language helper apps I already covered. These are useful for talking to patients when that is not your mother tongue. There are several apps for low vision patients that is there in this particular video as well as this particular Kerala Journal of Ophthalmology article. And so there are so many apps available. Maybe you can take a picture of this also. So many apps available. So Eye Handbook is probably what you will be using for most of the thing. iChart Pro if you want to have a remote control vision testing. Peak if you want to just do vision testing in an easy way. All the others are special use cases. 3D, I'll just talk about 3D photography because imaging is very important in ophthalmology, but not only that, stereo imaging is also very important in ophthalmology. So I had made a 3D atlas of ophthalmology, and I basically used an app called 3D Steroid to take photographs. So you can basically take two photograph left and right views and combine them in different ways to view in 3D. So for example, this will be a 3D image if viewed through a virtual reality headset. because the left eye and the right eye will get these separate images, and when you fuse them you will get stereopsis and see the image in 3D. So that is the 3D atlas of ophthalmology. So all these images are 3D. So this is a left and right side by side image for a virtual reality headset, whereas this is a red blue glasses anaglyph image. So if you get the red blue glasses, the 3D glasses, you can see the 3D in this image, and that is a very useful teaching tool also. You can get a lot of 3D anaglyph videos also, surgical videos also. So these are available on YouTube and iTube as well. So you can download that, you can use the red blue glasses and see the videos in proper 3D. And yeah, making own 3D content is a little difficult. If you have a 3D camera, you can do this. This is an iCam taken in 3 just because. Will not go into how to take 3D images, that is going to take more time. So now I'll talk about 3D printing. So 3D printing is a very useful technique for innovators as well as for teachers. So there are lots of 3D models available, and if you find the right model, you can use that for teaching. If you look at this is a 3D model of dialer or ball tip dialer, I would say, and this is a BHEX ring, and this is an Aurella backwards drainage implant, and these models can be downloaded and placed in your PowerPoint presentation by using insert 3D model from this device. So you just download these from this particular account, Thingiverse account of mine, or you can also download it from the National Institute of Health 3D website, and you will get so many other 3D models also. So you search for 3D models which are usually STL files or GLB files, can download them and start using them in your PowerPoint presentations. And these 3D models can also be 3D printed. So these are the 3D printed glaucoma drainage devices which I had used, and these were very useful for practicing surgical steps in the wet lab. So if you may not get access to the glaucoma drainage device or some of the other surgical devices, you can just 3D print these, and these do not cost very much. You can look up on Google and search for 3D printer near me. You might find some dental labs also which do 3D printing, or maybe an engineering friend, they might have their own 3D printers, because 3D printers nowadays cost only around 15,000 rupees for a basic model, and that can be used to 3D print all these things. So this is a modular keratome innovation which we had done, and these are all 3D printed models. This is a 3D printed model of an IOL, and this is a large size training model. So for teaching surgery, it might be very difficult to understand the concepts at a microscopic level. So this is a macroscopic 3D printed model in which this blue is an anterior first represents the anterior capsule stained with trypan blue. The nucleus is yellow here, and if the nucleus is out, you can see the posterior capsule is having an orange glow. So that is a useful tool for teaching steps of cataract surgery. And this is also Phaco Pro, which is 3D printed, and this is a translucent printed sleeve also. So all these things are 3D printed. And this is a 3D printed punctal plug, and this was designed actually by MBBS students when I was teaching in Ramchandra. So it is not very difficult to start learning how to do 3D designing also. So if you have ideas for a new device or instrument, you can actually start drawing on paper and then draw the 3D model and then start seeing if it will going to work, and then manufacture it. And the prototyping will be easier with this. This is a 3D printed glaucoma drainage device which can be used for designing new devices as well as for practicing in wet lab. This links to the video. And this is the foldable fundoscope. So I'll just quickly go through this. So this is how I designed it. And this is how the first 3D printed version looked like, and this is what a later version with embedded illumination and magnetic docking looks like. So this is now patented, and it will be this is in the process of getting it out. So thank you to everyone, and thank you, Dr. Prithvi, for having me in this IC.
Thank you, John. Thank you, John, sir. That was really great. I would like to invite Dr. Rohan. He's a vitreoretinal surgeon in Chaitanya Eye Hospital. He'll be talking about frugal retinal innovations.
Okay. Good morning, everybody. So I'll be talking about frugal retinal innovations. So first, coming to the glow port. So trocar cannulas are basically used as they facilitate smooth transfer of instruments and also reduce the trauma. However, room is basically slightly dimmed during PPV, and this can make port visualization difficult. To overcome this, microscope needs to be switched on and off continuously. So the aim was to the aim was to provide a frugal tool providing illumination for instrument exchange in VR surgery without constantly switching on and off the microscope. Sound is not there.
This is compactly fitted over a 25 gauge trocar cannula as shown. The glow device can be pre-fitted and placed over the trocar. After placing the infusion cannula, both the superior cannulas are placed with the glow device on it. The glow port is then exposed to light from the microscope as well as from the endo illuminator. If you have a green laser filter, you won't be able to capture the phosphorescence in your microscope camera. Under mesopic or dim room light conditions, we visualize the glow port glowing in the dark. The glow port, with its property of phosphorescence or glow in the dark, helps us in smooth and efficient instrument exchanges during surgery without having to repeatedly switching on and off the microscope light. The photoluminescence or glow stays for 10 to 15 minutes, and it regains its glow after a very brief exposure to the endo illuminator light, as is seen here. Ocular touch errors and effective surgical time is reduced for experienced as well as novice VR surgeons.
So we designed a phosphorescent glow-in-the-dark trocar cannula for smoother instrument exchange, and this was utilized in real-time VR surgeries. So this was a frugal, inexpensive 3D printed novel tool with good source of illumination, with smooth instrument exchanges, reduction in ocular touch errors, and reduction in procedure time, and was beneficial to both the experienced surgeon and the neophytes. Coming to the next one, visualizing the obscure, chromophobe assisted retinal surgery. Basically, in this era of microincision VR surgery with advancement of visualization systems and advanced surgical technique, still 10% of the cases require resurgery. PVR is the most common cause, followed by missed retinal breaks. And even one study said 64% of the cases were due to the missed retinal breaks. So missed breaks are often difficult and can be challenging, either due to previous laser scars or due to poor contrast between the choroid, or even due to pigmentary changes. So we describe a technique of occult break detection using BBG drug injected into the subretinal space with a 41 gauge cannula and the plume of the dye emanating from the break. So the first patient was underwent a vitrectomy for reg RD 3 months back, presented with dispersed pH and a subtotal RD. After aspiration of the dispersed heme, a break could not be found, so subretinal injection was considered. So BBG was taken in a subretinal injector with reduced PFI pressure and injected subretinally. After displacement with PFCL, you can see the bloom of the dye emitting at 2 o'clock position. So this was then followed by a routine surgery. At 3 months post-op, the retina was attached under oil with 6x60 vision. For the second patient, it is also important to know that there should not be air in the trocar cannula, otherwise they can have an inadvertent subretinal air injection. So after displacing with PFCL, you can see that the plume that I emitting from the occult break, and this was then followed by the routine surgery. At 3 months, retina was attached under oil. The fourth was a case of re-RD. After peeling the PVR membranes, a break could not be, subretinal BBG was injected, but a break could not be seen. So hence a drainage retinotomy was made and the retina was settled under oil. So BBG dye was selected because it was safe, as seen in various studies. There was another technique where they injected transclearly the dye, but it was associated with hypotony, choroidal and retinal hemorrhages, vitreous incarceration and retinal incarceration. So to conclude, subretinal dye injection is useful for occult or missed break detection. It provides a good color contrast. It helps in avoiding a posterior drainage retinotomy. Also helpful in recurrent retinal detachments, and this dye is also non-toxic and safe in Indian eyes. Coming to Lumi Indian. So in VR surgery, essentially we need 3 hands, one from the surgeon and one from the assistant. So during surgery, we need the assistant to actually depress first. It can result in slippage, sometimes miscommunication, and even an accidental retinotomy. So as a solution, we wanted to combine the depressor and the illuminator into one instrument. So the endoilluminator, it was placed on a hypodermic needle cap and secured with a microscope. And all these material are easily available in your operating theater. The video demonstrates how it is assembled. You can see the transclear illumination with the Lumin, and this frees up the surgeon's hand for either a base shaving or even lasering under depression. Now, what if you don't have an endoilluminator? You can use an insulin syringe with an LED light source connected to a battery, and all this can be sterilized except for the battery. This can also be attached to a power bank. So companies also provide a similar solution, but they are either proprietary. Urintan did a modified illuminated scleral depressor using a scleral bud, but then the problem is there can be blunting of the scissors. The wet cotton bud also loses form. All this can be easily overcome with the Lumin. So to conclude, it's a do-it-yourself, easily replicable, made using discarded material. It's sturdy, sterilizable, emits lights diffusely, and can be used without an endoilluminator. So coming to retinal light, during surgery, the most important aspect is visualization. Therefore, without a light source, it's almost impossible to do a surgery. So if the endoilluminator is not working, then what is the solution? So we needed a frugal novel illuminator device in case of emergencies. So the xenon light source is basically condensed onto the endoilluminator light pipe. 2 adapters were made, retinal adapter and a light adapter, to which you can fit the head of the endoilluminator and the LED light source. This can be mixed and matched with depending upon the operating system you utilize in your theater. The video shows how easily the device can be removed. To one end, you insert the endoilluminator head, the other holds a light source. But the problem was the illumination was a little low. So Retinal Light 2.0 was innovated, where you used a bigger, higher LED light source, but it required a heatsink and a fan. So this was a red light 2.0 with connected to a power bank. You can see the good illumination coming from that. Can even be utilized in VR surgery to complete the surgery. It's also useful as a source of retro illumination anterior segment surgeries, and even as a spotlight during orbital surgeries. So it's a frugal, it's universally modifiable, it's ultra portable. It can be used not only by the retina surgeons but also by the other specialties, and it's a multi-purpose illumination device. Thank you.
Thank you, Dr. Rohan. Next speaker is Dr. Prasanna. Due to some personal reasons, he will not be able to come here, but he has recorded the session and sent it to us. So we'll be playing the video.
So, Dr. Prasna presenting from the metaverse.
Thank you, KSOS and Prithvi, for this wonderful opportunity to talk on metaverse, pedagogy, and AI, the Smart Eye Clinic. So, I'm going to talk about one of my methods which started with cognitive video based learning. So, these are some of my publications which I'll be sharing, video based ones. So, if I'm going to teach what is an iris process and how to differentiate it from a PAS, I show them animated videos showing a fine arborizing strands in iris process, the broad basal PAS at different levels in the angle that it could be, and then take them into a real world where I show them that the fine arborizing strands does not cause rise in IOP nor causes any visualization to the angle structures behind them. Whereas on the right hand side, the peripheral anterior synechiae can cause rise in IOP or can cause visualization difficulty of the angle beneath them. And this is again another video of the pupillary block that is happening here, and this is the cause and this is the acute angle closure attack, which is the effect. So the cause is here and the effect is here. So I am playing this once again. So the aqueous is not able to go through the pupil because of the block, so it pushes the peripheral iris convex and that causes the attack. If you don't treat it here, it ends up with this kind of a picture of a post angle closure attack, of an acute attack. So we prevent it by doing a prophylactic YAG PA. So that's how we bring in concepts of teaching, where we do a Van Erichs first and then we go ahead, focus on a clip, and then the photo description is done. The firing of the laser is done, and once it is done, see the gush of aqueous that you can see here, along with few air bubbles that you can see again here in this part, and that's how the effect of laser happens. And if in case if needed, if you want to enhance the opening by an additional spot size, you can always do the focus, especially on a bridge of tissue here, and then the additional opening is done here, beautifully seen. And then finally the Van Erichs is again demonstrated, showing that a beautiful opening of the Van Erichs is noted pre and post the procedure. This is again another video, but this time without the Abraham lens, and in this I've slowed the video, slow motion in the iPhone along with the 700 rupee elephant boat adapter to document the photo description. So can you see this beautiful photo description, the blue reddish flame that you can see here? First time photo description to be visualized in my video that has been published. Again, some scenarios like post-operative ostium evaluation, a patent ostium, and then on the right hand side a blocked ostium. So the bleb may not be the only cause of rise to IOP post-trap, a bleb failure, but even the ostium can go in for an occlusion, and we always need to make sure that we do this, and these are some of my videos of that. Laser training moving into it. So I first show them the anatomy. You see the anatomy of all the 5 structures in the angle. Then show them how the ALT spot is done. It is placed between where the pigmented trabecular meshwork and the non-pigmented trabecular meshwork. And in the SLT, what can you see? The spot size in SLT is much bigger than the spot size in ALT. And this is a dyeing procedure of argon laser peripheral iridoplasty. So this is an eye with normal angle. Then after showing the normal angle, I'm showing the oppositional angle. And once an ALPA is done, as you can see here, see how it beautifully opens up. So this is an ALPA. Once it is done, see how it is opening up. So an argon laser peripheral iridoplasty, when delivered, it opens up beautifully. And can we see it from front on view? Yes, we can. The 24 spot size over 360 degree are placed, and you can see the beautiful ALPA procedure from a front on view. Can we see it from a gonioscopic view to understand the concepts better? Yes. This is a gonioscopic view. See how the opposition is relieved after the spot has been placed. So this is how the cognitive concepts learning was started with 2D animations, and then we went into the 3D animations, again another publication of mine, where non-dissectable structures like cavernous sinus, circle of Willis, and even eye for that matter, and the design of it was done using real-time confocal images of the angle as well as the fundus as well, you can see. And then even if you need to paint these structures after a 3D printed model, that can also be beautifully done here as shown in this video. And then this is the 3D model of the circle of Willis, these cavernous sinus, and even the eyeball as well. And then start collecting the autofluorescence and infrared, flect retina, fibrovascular band, retinitis pigmentosa, nerve fiber layer defect, to name a few. You just keep starting your collection and then push yourself further, where we landed up in the metaverse, the pedagogy, simulations, and AI. So what was it? So can we do something like holograms, because we have now come into the 3D? Can we go into 4D? Yes, and that's when came the birth of these two applications of mine, one for Android and iOS, where you can actually visualize the eye hologram in real time confocal images for the fundus and for the angle in real time. So on the right hand side you can see the mobile camera view that the students are seeing here, and on the left hand side this is the teacher here taking classes with real time simulation. So what a retina surgeon sees on day one, these students can see, and they can go in for an accelerated learning how a gonioscopy structure is seen, that you can see in this hologram on day one. You don't need to know the procedure, but this accelerates your learning with real images of fundus, angle, and whatnot. And again, this is a mobile camera recording of the same, showing the angle, and this is an NTG patient where color fundus, autofluorescence, infrared all have been added, and then we also validated it and published it. So moving on to the 4D, so with the portable simulator that you connect, that you can see I am wearing it, and then I can not only teach but also examine the patient's case sheet. So this is an NTG patient that I am seeing the splinter hemorrhage examination of the NTG patient, and then moving on to an RNFL defect examination, where you can see the beautiful RNFL defect can be examined in real time in 4D, and these are things that is up and coming, and again validated and published in the innovation section of IJO. So the flowchart is very simple. A patient enters into the hospital. From the database, our software converts it into an hologram of fundus and OCT together, where you extrapolate the OCT slices from the fundus, and you can actually counsel the patient before and also after. And multimodal imaging, not only a single color fundus, autofluorescence, infrared, low vision rehabilitation counseling, especially neuroanatomy teaching and neuroanatomy pedagogy. This is very, very good, where the complex neuroanatomy channel was studied, and we created this in total 3D, and now it is available in 4D as well for teaching. And again, one of my surgical simulators, when I did one of my mixed cases, I did have a stent drop, but all's well ends well. I placed the second stent first, and then you see the challenges is if you don't close your trocar, again I lose it in my phaco wound. So these kind of drop stent cases gave me an idea. Of course, I placed the stent rightly at the end in this case. I went back to my drawing board and I wanted to make a simulator for MIGS, because there is no such simulation models for it. So this is a metaverse where you can see not once but twice, you can practice the implantation of the stent multiple times before placing it or going for the real case. So this is me practicing the implantation multiple times, and when I'm in the right channel, a green cube comes in the image behind. So practice this multiple times, and then when I go into my real-time surgical field, my hand-eye coordination is better and I'm able to deliver a good result. And this is a patent-protected innovation of mine, also published in IJO. So the Gen Z kids, as you can see, this is my daughter, they love to play with this, of course, for their own reality, but this is up and coming, and on terms of it, we need to keep evolving and innovating, where this is one of my subtractive tools. So the Gen Z kids, they want the subtractive kind of a thing, where they subtract structures that they want to only see, rather than me giving them a particular image, where that led to the innovation of subtractive learning, where they can choose and subtract, and we created a brain model, an eyeball model, as well as you can see the neuroanatomical model as well. And not only that, in the camera, the phone camera, you can take it forward and take it back. So by doing it, you actually do a direct ophthalmoscopy simulation as well. So this is again another direct ophthalmoscopy 3D smart simulator that we made, along with the e-counseling devices that you can see behind me on the right hand side. So this is the metaverse. Welcome to the metaverse. We are at a very, very beautiful time, and this is my team which helped me in making this, and we have published it, and it's all open access and available. Along with the metaverse, to touch a few points on AI, which is a software application that you can see behind me, we have used human in the loop training, where humans taught the AI and humans validated the AI. Two human interfaces that we use to not only diagnose the glaucomatous defects but also give the intricate parts with good sensitivity and specificity. And again, we are moving in with angle and as well as OCT. And this is the UBM ASOCT anterior machine flick imaging multimodal angle AI that we are using for ophthalmic diagnostics and interpretation. So, to summarize, my dear friends, we are not at any war with anybody. This AR and AI, which we have developed within 60 seconds, which we are able to get the diagnosis and the models ready, they're all not an arm wrestling between the doctor and the AI. We are all going to work together for a better humanity. And this is what is my vision. And we have started our own startup called the Mahatma Center of Moving Images. You can catch us at www.mcma.in for our pedagogy, diagnostics, simulations, and artificial intelligence models, which are open access and very much available to all. And you can also catch me at my YouTube channel, which goes by my name, Prasanna Venkatesh Ramesh. Thank you once again, KSOS, for this opportunity, and Prithvi for giving me this wonderful chance to talk on my metaverse. Thank you.
So we have around 10 minutes. If anybody needs clarification or any doubts, suggestions.
Any questions related to any of the frugal innovations or apps? Anybody is anybody using smartphone to take anterior segment photographs? Can you raise your hands? Anyone? Nobody here is using your smartphone to take. Okay,
Ganesh sir.
only sir is using. Okay, so so many people tell that I don't have an anterior segment camera, I don't have a fundus camera. How can I publish? How can I present? Doesn't matter. You can use your phone to take excellent photographs. Whenever you see an interesting case, you can take excellent photographs. You can publish that. You can present it. So all postgraduates and fellows here, you should learn to use these. Okay. And anybody using smartphone to take fundus photographs? That is actually more difficult. Do you want to do a quick demo?
Prithvi, I just have a question.
Yes.
Just out of curiosity,
Yes, sir.
is there something called as medical grade LEDs?
Medical grade LEDs, I'm not very sure about that, but then there are LEDs that
Because
a few companies are using, and there are few LEDs which people are importing from US. Maybe those LEDs are medical grade, and that is being
So
used
is
for.
there a difference between medical
Not
grade LED
very
and
sure if there is a difference, but according to a lot of the papers that I've read, LED lights are pretty safe,
same?
and it actually has a retinal phototoxicity of very less than whatever xenon we are using right now in our practice. But I'm not very sure if there's some difference between the medical grade LEDs.
What LED sources you were mentioning, they are relatively cheaper when compared to a
Yes.
medically certified.
Yes,
this
yes,
source, no?
true. Yeah.
So
So there are a few companies that are actually giving us commercially available illumination devices.
hmm.
So those people are actually importing those LEDs from US. That's what I
So,
heard. Yeah.
is there a difference? Is my
Not very sure about that.
So we still have time if anybody wants to know more about say augmented reality or 3D printing or how to take a photograph of the anterior segment. You can just quickly, yes. Which one did you want to know about? Anterior segment. So anterior segment. Okay, I'll just give a few quick points. So if you want to take an anterior segment photograph with a slit lamp, you just take your phone, and very important tip, nowadays all these phones have 4-5 cameras in the back. Earlier it was just one camera, very simple. Now 4-5 cameras. When you start trying to align the camera to the eyepiece, it switches to the other camera. So what you do is you install this app called Open Camera. Okay, so first do that, install open camera, and once you install open camera, the camera doesn't switch from one to the other very quickly. So you put that, and then I'll just tell you how you can quickly align the slit lamp. So what you do is you have to take your left hand like this, put your phone horizontally between your thumb and index finger, and then what you do, you hook the left hand other fingers onto the eyepiece. Okay, the left eyepiece. So if this is the slit lamp's eyepiece, you hook it there, and then start a little further away, and sorry, so you have to keep the camera on, open camera on, and start a little further away and look at the light through the eyepiece. So you will see a circle. So if you don't see a circle, you have to move your hand around till you see the circle. If you're a little further away, you will be able to see it easily. And once you see the circle, you go closer and closer up to a maximum distance of 1 to 2 centimeter from the lens of the microscope eyepiece. Don't go and touch the phone to the lens. Keep at least 1 to 2 centimeter gap, and that is where you get the circle in the center of the view, and then you can zoom a little bit, touch to focus, and then click the photograph. So that
This
is
video
the
is
way I take photographs with the phone. You can get very, very good photographs with that. And
this is
if
video.
yeah, oh yeah, that's a video. An adapter, you can use that also. I suppose there is no sound for the video.
No.
So if you have the adapter, this is I think it's around 400-500 rupees on Amazon. You just put your phone into the adapter and then lock it in place. Make sure that it is not pressing any of the buttons of the phone. The phones have power button, volume button on the side, so align it so that it's not pressing any of the buttons. And it doesn't matter if the camera is center or side, just make sure that you tilt this to the side in which the camera is, and then lock it in place. Then you put the eyepiece. If the eyepiece has that circular thing which you can pull back, then very good, pull it little back and then put it onto the eyepiece. Then I'll just show you, there should be a gap. Okay, it should not be 0, it should be a gap, and the correct position is when that circle of illumination is seen. So there is a little speeded up, so you see the circle of illumination, and this is undilated fundus examination. So you can see the disc undilated and take a photograph of the optic disc also like this. If you use the hand directly, you can take photographs, but if you want to take fundus photographs, gonio, or take a video, then you can use the adapter. Initially it will take a little bit of getting used to, but once you get used to it, it's very quick, like within seconds you can take photographs.
Then there is another method where you can, if you don't have a slit lamp and you just have a phone, you can actually make your own device. You can make your phone, modify it into a macro lens photography device by just using a chart paper, keep a double-sided tape, and then using a puncher you can just punch a small hole, and between which you will put a intraocular lens. So the intraocular lens can vary from 15 to 20 diopters according to the field and magnification that you want. And then once you do this, you can just attach this piece of paper ASP onto the phone. So this will actually help you to make your phone a macro photography device. It can be used in all your phones, and you can just put your video on, put a flash on, and then you can just take it near to the eyes and take a video or image, whatever you want. I would suggest to take a flash on video and then take a screenshot, because sometimes focusing becomes a little bit of a problem. And these are all the images that were taken from this device. And then for the ones who cannot do it, I've also 3D printed the ASP. It's like a clip-on, so you can just clip this onto your smartphone, and you are ready to take images without a slit lamp. So that becomes more easier to carry also. And these are all the images that was taken with this device. This is a 3D printed device that is available. So I can give you my contact, so you can. The flashlight, sir. The smartphone flashlight itself.
So there is no additional light source needed. The smartphone flashlight itself is good enough to take all these photographs. If you want, you can put in additional light from the side, but this is good enough for diffuse illumination photographs. And then there is a slit scope also. If you want to take slit photographs, okay, we are almost out of time.
The slit scope is actually
No,
another
the clip,
device.
the clip for
The clip,
ASP.
the clip I can give you.
So if you want to make it yourself, you just take a piece of cardboard, make a circular hole in it. If you have a punch, you can use a punch to make a hole, put an eye hole in between, and that is enough. But that clip is 3D printable. Yeah. So if you want to make it yourself, we can do it. But if you want a 3D printed one, that also Dr. Prithvi is making it. So there are so many things which you can do with frugal innovations. I think it's 9:55. Yeah. So we'll hand over to the next session.